Shake that hair. Do it one time. Well, I'm about to do a podcast in a little bit, and we're getting some footage for it right now. You got
I want it blind on the top. I want some locks on the side. I want it papered, faded. I want to grow this out right here.
All right.
Make me beautiful.
What you just said now? You ain't about to get none of that.
Can we cut through the noise? Talk about the pain till our problems all fade away. You either build or destroy. We gotta make a change, so we might as well start today. Barbershop therapy. Barbershop therapy. Where I know that they hear from me. Barbershop therapy.
Well, basically, it's a space where men are comfortable having a conversation, you know, the ability to be in a safe space and, you know, be yourself. You're not a father. You're not a dad, a uncle, a cousin, boss, any of that stuff. Just a guy getting a haircut and no haircuts right now, but we're just going to talk about it.
Shameless plug. What's going on? I am Jamar Allen.
I'm Jimmy Evans.
And this is Barbershop Therapy. And what is Barbershop Therapy, Jimmy?
Well, Barbershop Therapy is a safe space for men to actually just be themselves. You know, take a moment, have the ability to not be a father, a boss, an employee, any of that. Just a guy getting a haircut, be comfortable enough to talk about everyday life.
Okay, I'll take that. I've had a couple haircuts from you. I think it's a good place to be. We got a special guest today, Mr. Jimmy. Mr. Jimmy, we got a special guest today.
We do.
Who we got? Who we got in the building?
Miss Keemia. Miss Keemia Shaw.
Hello.
Miss Keemia Shaw.
Counselor extraordinaire.
It's an honor to be here. Thank you so much for inviting me. This is a beautiful vision, and I am honored to be a part of it today.
Well, thank you for braving the elements because it's a nasty day outside, but we're going to make it sunshine in here.
And it is.
I like how you did that. That's well put together. So, Miss Keemia, Jimmy knows you. I don't know you too well. The people listening may not know you. Who are you and what do you do?
Keemia let me see really quickly. Keemia is I'm a human.
Okay.
I'm a wife. I'm a mom. I'm a woman of God. I'm a business owner, and I'm still an employee for right now. But
okay.
I am just a person who has been gifted with the opportunity to listen to people and hear the heart of those who may be hurting. And God has given me the strength and the wisdom and the ability to offer and support people as they go through the difficulties of life. I forgot.
It's great. I've never heard it explained like that.
That's essentially what it is.
Explaining myself. I'm about to change my bio on my website right now.
By profession, I am a licensed clinical social worker. I graduated from the Fayetteville State University, home of the CIAA championship Broncos. So I have to rep them today.
Plug.
That's right.
We'll make sure we edit that out.
So graduated there with a bachelor's and master's degree, and now currently working on a doctoral degree.
Okay.
Awesome. Well, Keemia, can you tell us more concerning different types of therapy that people need and why they need them?
Okay. Well, the therapy that I practice is strictly conversational therapy. I see individuals who have anything from anxiety, depression. I utilize a bevy of tools: cognitive behavioral therapy, dialectical behavioral therapy, Christian counseling, in order to support the individuals who may be suffering in some way. And so the talk therapy, it is strictly just a conversation, because sometimes people don't know that they have safe spaces to go. They don't have a trusting confidant or a person that they can just relay how they feel. So this is what we do at Legacy Family Services, which is a practice that I run. The counselors that we have on our team, we are skilled, we are trained, we are educated to support individuals through the issues of life because they don't stop.
So I have a quick question. You said anxiety. I don't remember. I don't remember growing up at any point in my life, and I'll be 40 this summer. I don't remember ever hearing the term anxiety so much in my life. Mm-hmm. So is this just something that the public is getting a hold of? Is that term, or is it just something that's increasing more and more? I know COVID definitely increased a lot when it comes to mental health for men, women, children, everybody. Mm-hmm. But the actual term anxiety, what is anxiety? That's my question.
For our community, for the African American community, we very well likely have not been exposed to the term anxiety. We feel it. We deal with it every day because of the generational traumas that we are experiencing and have been exposed to. So those feelings that we have, we've just carried, right? Mm-hmm. So some of our other counterparts who have been privy to those terms and have the means to get the support and exposure. That's the truth. And exposure to the treatments have been able to be just a bit more successful than we have. But the one thing that we have in our community is what a lot of people kind of resent is the resilience to overcome. So anxiety is feelings of stress. You may feel like you're not good enough, and you can feel it. There are visceral reactions when you have feelings of angst. You may be sweaty. Your heart may begin to race when you're put in different situations. And so that's what we do in counseling. We kind of help people identify the triggers, which means something that brings about those feelings. And we help learn skills and tools to navigate through deep breathing, yoga, mantras, so we just have the tools now. So it has always been with us. We just didn't have a name. So that's my answer.
Now that's interesting because in the barbershop, that's typically the case. Guys come in and they don't have anybody to talk to.
Yep.
And they're not comfortable with talking to anybody because what have we been taught? Men don't cry. Men don't have emotions. Men be a man.
It's a sign of weakness, expressing emotions, and as human as it is to cry, to feel sad, to be disappointed, a lot of us structurally haven't been taught how to communicate that, and that's vital. And I know it with you, knowing you 15 years, 15 years. As my hairline receded, so did my reservations with my feelings. I've learned as my hairline went back. So did my wall. But there were times I talked to you about things. I'm so glad that we starting to understand like what it is, because I remember that feeling, man, like the hot flush feeling or the stuff. And then it's like, go ahead and do it anyway. And it's like, we didn't get taught, like even in church, it's kind of like, go out there and do it and different things like that. How to deal with those things. So we just react. And but I told you my whole life. So it was.
But that's actually a beautiful thing, because we may not have had the formalized or clinical tools or wording to assist. But I love the church scenario, because the church say, go ahead, push
just
it. You can do it.
Pray about it.
But that much is true, because these are tools. That is a spirituality, and being a believer is a powerful weapon. It is a powerful tool. But to push someone, that's what we do in therapy. We help the person push past. So that's exactly what the church, even though it may not have been received well by everyone, but that's the goal, to push you past the fear, because fear hinders you. It'll stop you from meeting your greatest expectations.
Yeah.
I think the thing with me is church is awesome. Church is a great place for us to be. But we have to also use other tools.
Absolutely.
And understand, the resources that we have in front of us.
Absolutely.
So, over the last few years, I've discovered that I needed therapy. So I've started going to therapy and
awesome.
Figuring out these tools that help me communicate better with my kids,
awesome.
with my spouse, with my parents, with my siblings, and understanding that this is all relationships or being in relation with people. Like these terms I've never heard. I'm 51 years old. So when you start talking to people about these things and breaking down barriers with dudes
for sure
in a barbershop, and it's like, nah, man, I didn't realize I didn't know how to communicate with somebody.
For sure.
That's powerful.
What do you think turns Black and brown people, minorities, Is it just something that's foreign that turns us off from therapy? Because, we were told, like, it was horrible terms like the crazy house or shrinks or something like
Special.
that. Yeah. So it's like, what is it about? Like, what is it about the structure of like mental health and going to somebody and getting help, like as men, because we need it so much, right? So what is it about that? And I know we talked about, faith and religion. What is it about that turns a lot of churches off? Like, why, as us as a people, what makes us kind of go the other way?
From my perspective, it's xenophobia, which is fear of the unknown. So if you are not familiar with something, sometimes people are uncomfortable. We are distrustful. Now, we're engineered to not trust each other.
Understandable.
That has been going on since the beginning of time. But I am so honored and blessed to have a position whereby we can help people break down those barriers and that xenophobia. You know what? It is new. But if you don't explore something new, you will never see how far you can actually go and the things that you can actually accomplish and overcome. So I believe it's fear of the unknown.
So with that being said, when you think of these terms, again, stuff that we've never been exposed to, never knew what xenophobia was. Right. Anxiety, again, it comes up, but we don't know the actual clinical definition of these terms, which then gives us hesitation or pause, because when people start speaking to you over your head, it's like, I'm not really sure I want to go into this, because first of all, I don't know what you're talking about. Secondly, I don't know what you're talking about.
Yeah. And if you want to put a third up there, I don't know what you're talking about.
Very, very true. But see, that's why, we're multilingual. We can speak. We turn it on and turn it off. So code switching.
We
have yes, how are you? Thank you so much. We have that down pat. And we also can, girl, I ain't got nothing. We can speak to each other in a way that is heard and is understood. Sure. Most recently, the young lady who broke down the Ukraine-Russia, oh my goodness, I thought it was so phenomenal. And I laugh because we do that when we are talking to people. People come in, they're uncomfortable, but they recognize that, I've been feeling anxious lately. My sleep hygiene, or I haven't been sleeping. Sleep hygiene is a clinical term, sorry. But I haven't been sleeping well.
I was about to ask about it. I was like, sometimes you get a little down, and you don't take a shower, but I didn't know it was
correct.
Sleep hygiene.
I've been feeling down for about 3 weeks now, and I can't shake it. So, okay, girl, so tell me a little bit more. And once that person begins to share the symptomology that they have been experiencing, we are able to use our trusty DSM-5 manual to kind of put those symptoms in perspective and come up with the DSM-5.
What she just said.
We can Google it.
That's our manual that we use to look at the symptoms that the patient presents with and come up with a diagnosis for the symptoms that they have described. So when we see a person that has a certain number of symptoms, we're able to put a diagnosis with it and then formulate a treatment plan. If this has been going on, let's try to do some things differently in your life. And it's simple things sometimes. Sometimes, what are you doing before bedtime? Are you scrolling too much? Put the phone down. You have to prepare just like you prepare your children.
Cool down. It's like an exercise. It's like to warm up, cool down.
Exactly.
And you got to decompress.
But this rat race of life that we're constantly in, coupled with the generational trauma that we have been exposed to, coupled with the police brutality that continues to plague Black people, we have so many layers of problems.
It's advertised now more than ever.
Ever. We have so
this
much.
Is a perfect time for us to address it. Like, with you giving all the different scenarios, generational traumas,
absolutely,
the police brutality and things of that nature, as a father with an 18-year-old, 8-year-old, and a daughter that's 7, all of these things is the first thing I wake up in the morning thinking about. And people don't look at that as just trauma and stress. You know, those are my concerns, and that's what we've been programmed as men, to protect these interests, protect these children, protect your spouse. So,
but forgetting about yourself.
And forgetting about yourself. That's where barbershop therapy come in.
Safe space.
So,
safe space.
How do so in that time, I know my therapist tells me all the time. She asked me this and that triggered it. So she asked me this question one time, and I didn't have an answer for her. She was like, "Describe me who you are and who you want to be, but don't mention your family. Don't mention your kids, mention your wife, mention nothing." And I sat there for 18 minutes because I had lived all these years and I had no idea what made me happy.
And who you are.
And who I realized that I played ball, but ball is just a coping mechanism. Like we play ball to get out the house. Like, I'm getting up out of here. And that's also was pushed on us by society. Basketball player or entertainer, or it was never engineer, doctor, lawyer, counselor. It was never any of that. So let's say I'm listening to this podcast, I'm watching, right? And I'm like, man, some of the stuff they talking about, I don't really know. I ain't gonna. Where do I start? Like, what's the questions I ask myself, and then what's the steps I take to get to your office? I've never been to therapy. I work my 9 to 5. I do my 12-hour shifts. I come home. I might have a little drink or whatever it is, decompress, because I've been a character at work now. I've had to wear this mask at work
all day long.
Now I gotta come home.
What they call it? Representative? Is that your
representative?
Okay.
Customer service, the front desk lady, right? I've been wearing the front desk, and then I come home and I gotta be super dad. And I also gotta be affectionate and considerate and compassionate and a provider and protector when I'm here. Like, how do I get to peace? Like, what steps can I take?
You know what? That was so powerful because the question that you asked me, who is Keemia? My first answer was, I'm human. We forget that we're human.
That's it.
We have flaws. We have layers of emotions. And I was able to tap into my humanity just this week because I lost someone that I love very, very much. And so having to be a provider to other people through pain is very, very difficult.
Absolutely.
So I had to be honest with my clientele. I'm human.
Right.
May not be on 100% today, but I'm here for you. So acknowledging that you're human is the first thing. So to the person who may be listening, know that you're human. Know that humans need other humans. There's a scripture in the Bible that it says it's not good for man to be alone. People often equate that to a marital relationship, but it's not necessarily so. We need each other to survive. You have to hear someone. Someone has to hear you.
That village
is so important. So to the person who may be listening, understand that you are human. And when you recognize that there are some things that you may be feeling that are uncomfortable for you or uncomfortable to your environment, because sometimes we don't pay attention. And if everyone is telling you something is going on and you continue to push it away, it may be time to take a look in the mirror and say, you know what, I'm human. And it may be time for me to reach out to someone.
So that goes back right to what we were talking about early, is learning how to be accountable to yourself.
Absolutely.
And so, again, more terms that a lot of people just are not familiar with. And so as we're growing as a person, we should mature. You know, you don't do the same things you did at 1 that you do at 7 or at 7 at 14. So there should be some growth. But a lot of times we get stuck in that growth. And I learned this term, you know, dealing with my son is, what was the term, Jamar? Arrested development.
I was about to say, you asked me to remember. You know, my memory is.
He's stuck.
Right, he's stuck in
somewhere.
And when I learned, you know, how that affects a child, and we, as you know, I guess moving into another type of thought pattern, when we look at our children and we say, "Hey, do this," and we expect them to do it perfectly because the first time, because of how we think we know how to do it, we know how it's supposed to be done correctly, but you have to equate it to, you know, a person going to first grade and somebody expecting them to graduate from college the next day. It's an ongoing process. Where we all have to learn how to mature to the things that we want to be and not necessarily where we currently are.
Absolutely. Grace. Giving someone grace to grow, grace to make mistakes. And being a mom of my daughter is 26. She's now that.
What you use, Avon? I'm sorry. I know it's serious. So your daughter
She's
26.
26 years old, and she is
Vaseline?
blossoming. I'm trying to continue.
Like this segment is sponsored by Skin So Soft or whatever she using.
I'm gonna drink some water.
Oh, okay, water. So, okay,
She is blossoming.
The labels is off, but get you some. We don't know where you're gonna get it from.
Water.
Yeah.
But she is growing and developing. She is brilliant. She is beautiful. However, there have been some hiccups. There have been some difficulties.
For sure, yeah.
And we have had to learn and grow together. So my prayer has always been, even from when she was a child, I used to laugh at myself because I said, I don't know what to do with this little baby. I'm holding her up like roots. Lord, help me to help her to grow. And he's done just that. But again, even in that, we have had to grow and learn together and allow her to go out, as hard as it is as a parent now, to watch your child make some mistakes and fall down and you don't do anything. It is hard. However, it helps to grow them. It helps to support them so that they can go on their next journey.
Gotcha.
Okay, so I'm gonna hit you with another one, Miss Keemia. When you think about a parent, we make mistakes.
Absolutely.
And we have to be accountable to our children as well, right?
Yes, you do.
So how do you show accountability when you're not accountable to your child or to yourself?
Very difficult. And that will make the relationship very difficult, because if you are not able or not at a point where you are able to acknowledge that you didn't do things, you did the best you could, because I don't knock parents. I don't knock the children. You've done the best you could with the information that you had at that time. Think about our parents. Kind of strict, don't do this, don't do that.
Do as I say, not as I do.
Correct. Or we're going to beat you before the police get a hold to you. They were trying to teach a lesson. They were trying to help save you.
But they teaching trauma.
Well, they learn trauma. That's that generational trauma, generational curse.
We sit back and say to our kids, watch out for the police. Well, don't do this. Hold your head up straight. Get a haircut. And that's, we all teach. We've always been taught what not to do. We've never been taught what to do. But
you have the opportunity as a parent. You get to do things your way, and that's the beauty of evolution. You may not. You'll go back and think of all the bad things, and that's sometimes we get so stuck on the bad things rather than focusing on the good. That's that cognitive behavioral therapy, because what we think we're going to behave in that way. So if we start to look back at some of the good that they do and start trying to look at the message that they were trying to send and not the way they actually sent the message, will change the perspective.
Perfect point. Because like we were talking in the barbershop a couple of days ago, it was hear the good information and not necessarily how it's being delivered to you.
Absolutely.
And that's the part of the communicating that we have not yet mastered, because we've always been told what to do generationally. It's not a conversation on how things are done better.
They didn't learn to talk. They were told to be quiet. You can't talk. They couldn't. Some of our ancestors weren't able to learn to read. When we got information, what?
Literally just talking
anxiety.
That goes right back into that
exposure.
That exposure for one, but that generational, like I said, 100 years, 150 years ago, we had the threat of being killed because we could read. And so now that still is prevalent today, because I can't speak on nobody else, but I don't read a book a week.
Absolutely.
Because we got to work every day. Pay these taxes. You understand?
There you go.
But the thing about life is life continues to occur, and the issues of life don't stop. So that's how therapy assists us. We continue to learn different ways to help us navigate what we have to do, because you don't want to be unemployed. You are a successful entrepreneur, been owning a barbershop for I don't know how long. This has provided a comfortable life for yourself, and your family. So you're not going to stop that, right? You, sir, you have a beautiful family, beautiful wife you talk so highly of. So we're going to continue to work, but now we can do things on our terms.
Absolutely.
COVID has leveled the playing field for a lot of individuals. Our ingenuity has come back to life. You know, when we didn't have masks initially, I got some girls with sewing masks like it wasn't, and they made a mint. You understand?
That's right.
So we have
That's
to
right.
learn. That's that resilience. So a lot of times with my clientele, I do a lot of EAP, which is employee assistance professional.
Okay.
When employees come in because they're exhausted, the boss is treating them terribly, they're not promoting at work, they're doing all of this overtime, and you have to help them to look at things in a different perspective. COVID allowed us to do that as well. Eating at home with your family. Instead of saying, I'm stuck at home. No, I'm safe at home.
Yep.
Changing your wording, changing your thought process
Language is everything.
makes
It is.
everything different.
Build you up or tear you down.
Easy.
For sure.
Yep.
Man. So with you understanding the pressure that we can relate to as men, right? So with you going through what you're going through with the transitioning of your aunt and still having to function, right? So I'm assuming you pull on your faith.
Absolutely.
I haven't had any conversations with you outside these chairs right now. I'm just gonna guess that you pull on your faith, right?
You got discernment.
You know, I got the gift. You know? But so with knowing that, let's say I do want to go to therapy. I'm at my church. My pastor isn't necessarily the most whatever, and I decide to seek an outside source. What do I do if my job doesn't really provide insurance for that? You know, is it a sliding scale place I can go to? Maybe I make too much for Medicaid or something like that, and maybe like what I have in my job covers just like a physical a year and whatever else. Like what are my options? Like, all right, Miss Keemia seemed cool. I bet her team can help me out. What's my options of getting to somebody if I don't have any insurance?
We do work with the clients that contact us because everyone doesn't have insurance. We don't currently accept Medicaid per se. However, we do partner with or refer to the providers who are on Medicaid panels.
Gotcha.
So one thing we tell people who may not have the insurance or they make too much to afford certain types of things, we say, what does it cost to you? How much are you willing to invest in yourself?
For sure.
Because therapy is for you.
Yep.
So if you're not willing to invest in yourself in order to improve the mood that you have described, then maybe it's not the time. But we encourage you to really think about it. How much are you willing to invest in yourself? We'll go out and spend. Well, that's men. You guys will buy those J's, and I got a couple
That's
of.
some men.
Yeah,
some men.
that's another podcast.
We about to buy no J's.
I mean, women will go out. We take care of ourselves.
For sure,
we
yeah.
should.
But we'll spend $600 on a car payment.
It's priorities though.
But
Priorities.
$125 an hour.
Ooh, that's too much, girl. They high,
Crazy. But I go to Outback or go to the crab place and get some seafood.
Right.
Drop all that money.
Drop a
but it's
dime.
like when it's like So and it's
how important is it to you? How important are you to you?
Yep.
You've described that you're not feeling your best self. You've described that your mood has been at a constant low for the past few months, and you're not being able to be present with your children, your husband. You can't even be there for yourself. So if you're not willing to invest in yourself to foster your improvement, then you have a little bit more work to do. But there are providers that are available that are willing to help. Right now, the referrals are coming in constantly because people are hurting and they're recognizing, you know what?
Yeah.
I've been trying to do everything and be everything for everyone else, but I'm not here for me.
Well, it's hard to invest in yourself when you don't have the time to invest in yourself. And you people will say, well, don't you have time? Because you're so busy feeding into everybody else's life, everybody else's problems, and putting on that hat to be a mom, to be a dad, to be an employer, to be an employee, to be somebody else's sounding board. That again, when Jamar made that, had that epiphany of who I am, it's hard to recognize who you are because we've never taken the time to sit back and say, what do I like? Because a lot of times relationships are give and take, but a lot of times people just give. and they don't realize, and that's like to your children, to your family.
Them little boogers will take everything you got.
Listen, drain you dry.
That 26-year-old, I love her. I give her the shirt off my back and have done so. And I don't care because I want her to be greater, be better than me. You go do B. However, learning and knowing what I know now, you have a pace. Pace yourself.
Balance. Got to have balance with it.
You don't have to rush to do anything.
Oh my, I love that. So theoretically, we got about 10 minutes of time left, right? We're going to have a part 2 with you. For one, we already knew that from the pre-production meetings. But
that was already planned. Yeah, she didn't know that, but that was planned.
It's already in
You see how they do? Planning my time.
But that's the beautiful part of that. Society always puts like time limits. You got to have a baby by this time, married by this time. So that's one thing I tell my girls, man, is like you can go to college, but you also can take a year and go abroad. Don't let these other cultures go experience all that the world has to offer, and you just stay here and do this. Like I give them the liberty to operate how they feel, and it's like, all right, what's your plan? All right, you don't have a plan. Like, all right, so my middle girl, she never has a plan. She's me. She's just impulsive. If she's with it, she's 1,000% in. If she ain't,
let her be.
I ain't even showing up.
But you got to know yourself, right?
Right.
You got to know who you are.
But that's like that goes to what she's saying, and I'm like, I learned that, man. I can't expect her to be my older girl who's like honors and graduating early and has her own business. She braiding hair, trapping out the house. You know, I looked at her cash app. I said, wait a minute.
Please and thank
no
you.
idea.
What is trapping?
Statute of limitations. We got a lawyer coming on another episode. We can talk about that.
Talk about terms.
But she's just like, she plans it and she journals and and I realized I was like, Poopa ain't like that. And I realized like, how great would it have been for me? And I hate to think about coulda, shoulda, woulda, but how great would it have been for me if somebody had looked at me and said, you ain't got to be a sister. Like my sister was a crazy basketball player, and I always got compared to her, and that haunted me to the point where I resented my sister. Like I was just like, I mean, I love you, like you. She beat people up for me, everything. Like before you used to beat people up for me, she beat people up for me. So, it was she was everything to me, but I started to slowly resent her because like so many people, like comparison kills. I never forget a sermon I heard about that. Just comparison kills. But just the liberty of allowing her to become who she wants to be as I'm still finding me.
Absolutely.
And it's like, with them, like we're finding ourselves together. It's a journey we're taking together.
I think that's another conversation that we're gonna have to have later is about parenting, right? So parenting has
it's gonna be a 2-hour episode.
Yeah, you gotta mature into parenting
Absolutely.
as well, right? So your children should be a result of your maturity. Like if you have multiple kids, your first one is your science experiment. We don't know what we're doing.
That's the first paycheck.
You gotta hold up like roots.
Yeah,
I told
you sitting back and because most of the time when you have your first child, you're young, right? And when that youth comes in, you're gonna do youthful things. You're gonna make youthful mistakes. But when that second child come in, there should be a little more stability. There should be a little like, I didn't do so well on that part, but. I'm now.
Sounds like a great plan. I'm just letting you know, it sounds great.
But it sounds
theoretically right.
Bombed on all.
But that's the thing is once you start having these tools that we're talking about, then that's where the maturity also comes in. Because I know 60-year-olds that are still immature.
You're right.
As parents. So when you start looking at your kids, each one of your children should be a result of your maturity level. You're gonna have some kids that just ain't gonna get it. They just ain't gonna get it.
But probably gonna be a boy.
Though. Eventually they will because we did. Yeah. We didn't do everything right. Our parents didn't do everything right. However, I believe that God honors the motives of the heart.
Absolutely.
So where we don't see that we did it perfectly, we did it right, we had intentions to. We didn't intend to harm. But it's no harm because he makes all things new.
Whole nother intention.
For sure.
Yeah,
for sure.
We're not intentionally setting out to harm anyone. We're trying to do the best we can with what we have, but now we have other tools to help support us. Example, immediately you go to Pop to correct a little child.
Slave
now,
mentality.
Right. But now we give warnings because I don't believe that a corporal punishment is completely a bad thing.
Oh, yeah.
However,
No, that-
abuse is.
Right.
So we learn to, give a few chances before you immediately go to
But it's
the,
that grace,
the
like
popping.
you said.
It's the grace.
When
But you
got
to give that to yourself too.
But you have to learn that is an actual thing.
It's starting to look like a 2 Live Crew video. There's a whole lot of butts going on in here when the therapist talking, Jimmy.
I'm just saying.
You be saying she'll hit us with some good stuff, and you be like, "But a whole lot of butts in
But
here."
that's okay.
No, that's
okay.
conversation.
That's it.
All
We're
right.
just pulling
Okay.
out different
I just wanted to throw you under the bus because you cracked a joke on me before we started taping.
But it is wonderful to have the butts
For sure.
because it's
For
a
sure. For
conjunction.
sure.
We are
For sure.
continuing the
Yeah.
conversation.
Yeah, I was just capitalizing because I had to get him back. It's just brotherly love.
But I love the conversation that you shared, the information that you shared about your children and yourself with the comparison. Again, 26-year-old, much like your eldest child, dotting I's and crossing T's
gosh,
all
yeah,
the time.
sticky notes and everything.
Yes, all of that. But so much pressure to become
Perfect.
Yeah.
fall
And she
back.
struggled with anxiety to the point to where
There we
like
go.
eczema would flare up.
Exactly.
And we had to go tell her like, yo, C's are okay.
It's okay.
Like it's okay. And it's like, and she did all that. And it's like, I'm graduating early. I'm going to Wait Tech, take a 5-month course on braiding hair. All right, well, just take some financial courses on the side,
Right.
so you know how to
Handle
or
your
marketing, so you know how to market your business. And she ended up finding like a piece in there, and I was like, all right, I haven't come to her. I hope she doesn't hear this, but I didn't come to her and say, well, I told you so. You was tripping for nothing. But
They
for
have to
her,
learn.
she had to learn, and I learned that she learned like there's nothing I could tell her
Absolutely.
to change
Oh, you
how
can't
she
tell them
felt.
that.
There's nothing I could tell her.
And that's a big thing as well when we discount a child's feelings
Oh, yeah.
because you're a child. Oh, you don't know what you feel yet.
Bad habit I had too.
Yeah.
Yeah.
But we learn from it.
Yep.
Allowing children to express themselves in the home in a safe space often offsets them going to express themselves using maladaptive coping mechanisms outside the home.
What's maladaptive coping?
Drinking, illicit sex, drug use. These
Gotcha.
are called maladaptive coping mechanisms
All the
because
stuff
they're
we
trying
did.
to numb that
She named
pain.
everything we did.
that we
Thank God for the blood.
It still works.
It still works.
It still
And it
works.
reaches. But anyway,
But that is that's the
super,
thing
super.
is being able to recognize, right? When we talk about these types of coping mechanisms or these bad habits or whatever it turns into because you didn't have that resource at home
That's
or
right.
that support that you needed as a child. This is where that maturity comes in, and we all grow as people, as humans.
You want to be what you wanted to have to your children.
That's right.
But you still don't want to forget the good because everyone's
sure.
parent. But there are some parents who are just trash, and that's just the truth.
Yeah.
But they were trash. They were hurting themselves. Broken people break other people. So when you have you two trying to be the best dads you can be, the healthiest dads you can be, your customers who are able to come in and share the struggles, that is actually a blessing because people suffer in silence. And what I want people to understand, you could be the best parent in the world, but your child can have a different perspective. They can think,
Totally
they
different.
weren't.
Yep.
You like, what? I broke my back, girl. I gave you
She
everything.
like, that ain't even what I wanted.
I just need some love.
Perception.
Yeah.
I didn't care about no J's.
They didn't care about any of that. I just wanted you.
go
I
get
wanted a
pizza.
hug.
That's
Yeah.
right.
And
That's
a lot
right.
of like
sure.
I had a couple of my friends that would say the same thing. My dad never hugged me, and looking at my dad, great guy, my Superman. If I said, "Hey, Dad, I want to put a barbershop together," boy, come on, let's go on and put this thing together. We're gonna go ahead and chop that down and measure this, and we're gonna make that thing. Yeah, we got it. We got to figure it out. But if I was looking for him to come and give me a hug,
Nope.
like my kids now, my oldest, not so much of a affectionate person, but my younger two, Dad, you're the best dad ever. I love you. Oh my
Give 'em some
God!
candy.
That's the cocoa melon
that's
kids. They grew up on cocoa melon.
Exactly. But but for me,
Yeah.
I had to come out of some of those habits that I was forming as a doer and not someone to show affection to my kids because, it was something that I was never particularly shown on a regular basis.
But look how different you are at 18 years ago when the eldest son was born, you were a different person.
Absolutely.
So you have evolved.
Maturity.
Now you're able to understand that they may need an embrace, and perhaps the 18-year-old,
he needs it too.
He may come, and you'll have a different approach.
I feel great because my 18-year-old is in the military right now in basic training. And when he gets off the phone, he says, "Hey, I love you, Dad."
There we go.
So,
it is beautiful.
I'm a smile.
And I'm gonna tell you, I love yous go a long way.
They do.
And that has helped me in this week, this process that I have been in with losing my favorite aunt in the world. The conversations always ended in "I love you." So there's not a question, know.
Sorry to
go
cut you
ahead.
out, but what made her your favorite aunt?
Oh my God, so many things. This is what we ask a person in therapy doing grief counseling. Tell me about that person.
See how I did that?
Oh, you
Turn it around.
come on, flip it on me. I like
That's
it.
right. That's right.
But she was just a wonderful person, bringing family together. She was essentially the glue. I learned cooking from her. I learned encouragement from her. Faith from her. Her favorite thing: don't worry about the mule going blind. Sit tight and hold the line. Wait a minute.
Wait a minute.
Play
a line right there.
If that ain't faith, I don't know what is. So these are
You
types of things that
Pull that snippet.
I'm able to pass on. Being the oldest grandchild,
sure.
oldest niece. So
sure.
I get to take everything that she poured into me and continue
Pass it
that
on.
generation.
That's right.
So continue it out through our family. So it has been a very painful time, but yet a beautiful time because I have so many fond memories.
Oh, man.
And that's what we want to have for our kids and for our family. We want to make good memories.
For sure.
We'll have some sad times, of course, because life continues to happen. It does not stop. But we want those positive memories to outweigh those negative ones.
Absolutely.
So,
Absolutely.
and I think one thing we got to remember, and I remember somebody told me when she said that, I thought about that. She talked about the cooking and different things, is we're not really raising kids. We're raising adults.
Exactly.
Because they're not going to stay kids. They're going to grow to be adults. So that whatever we pour into them, and I'm praying for that. And that's something I'm believing in. And I'm taking everything I can now in this latter part of my life because there are like two of my kids that I don't have necessarily super consistent relationships with, but my goal is to prepare myself for them to be able to express how they truly felt when the time comes. And I can handle that, and I can also give them the tools because my daddy ain't know no better. My dad, but I learned grace because I sat down with him one day and he told me, like, ain't nobody ever, my daddy went around and so, my daddy did this. He died when I was about, and I was like, well, that makes sense. So all these skills that I learned from and that's why I ask about aunts and uncles. I learned so much from them. It was just like good and bad habits. Like, but a lot of good life stuff came from the people around my parents when I couldn't necessarily go to them like I wanted to, and I was able to go to them. So hopefully this barbershop therapy becomes like the aunt and uncle for a lot of men,
people.
Absolutely.
and that they can come here.
And it doesn't just stop with one space. We got barbershops all over this country.
All over.
And if other barbers and other shops take a moment to hear people and understand, hey man, what are you going through? You need a minute to talk. I see you came in, your energy was different today. What's going on? That goes a long way.
Relationship is
Opening the door.
Just to say, hey, I have a moment to be vulnerable and safe to say what's on my mind and not get judged, not get torn down, not get, compared, all of these different things that we go through that are different variables in each person's life.
Absolutely.
So,
Miss
I
Keemia.
want to say,
Yes.
Go ahead.
thank you, Miss Keemia, for
Thank you, Miss
all.
Keemia.
It's
all
an
this
honor.
positive energy.
Thank you all for having
This is a
me.
good part one. We definitely gotta have part two. Because
3, 4, 5.
And 78, part 78.
And,
but what your practice? Where are you located? If you want to drop the name, like, because I want to know, because I'm gonna send some people. You take Blue Cross Anthem.
We do.
Okay, I know most of my people in my circle got this. Before I refer
We do.
somebody and waste their time.
We do. But Legacy Family Services, we are a nationally based organization. We have practitioners that are throughout the country, and we do accept. We're on several panels of insurance, and you can contact us at 919-931-1634 or online or at www.yourlegacync.com.
Okay.
All right.
All right. Well, we are super grateful. You are officially our first guest. Yeah.
Jimmy, thank you.
We are super grateful.
Thank you.
It really beneficial. I noticed in the Zoom calls and stuff, and Jimmy told me about the people he's putting together and stuff, and I was like,
doesn't
man,
he have an expansive
I was
network?
like,
I'm on
I was
line.
like, man,
What?
I was like, I don't know. I'm from.
Tell everybody.
I'm from a little, I'm from the hood. So I don't know that I would have met a therapist, a lawyer. I don't know that I'd meet all these people, but he's super resourceful. I'm just glad that you decided
What's
to,
the name?
to push for
Headquarters?
it. Headquarters
It's true.
Barbershop. He said he don't want to promote it. But we're gonna talk about
Please.
it. He kept dropping the fact that I was cutting his hair one time. So he plugging the
Headquarters Barbershop. He
Headquarters
knows
Barbershop,
somebody
Capitol
that knows
Boulevard,
somebody.
and I'm super grateful for people like yourself
It's
and
an honor.
people like Jimmy that care enough about the village and community, to just build up and not just sit back in a seat of judgment. Because me, I've always looked at you as like a bigger brother. I never looked at you like a dad because you never like put your thumb on me and that you all like no matter what. And I know it was times in my life where I was like hustling and stuff, and I came in there smell like who knows what. You never said it. You always show love. And when I look at his circle, I can see that it's people around. I see his growth. I see the people around him, and it's still a level, man. So I just want to honor you on this first episode. I'll shake your hand.
Now you see
Appreciate
that?
it. I appreciate it.
We need that.
We need
that.
dinner too, and it'll be on you. So that wraps up our first episode of Barbershop Therapy
Thank
with
you,
Miss
thank you.
Keemia.
It's an honor.
Absolutely. It's
Part
been a
1.
Had a ball with you today. And
Thank
Jamar,
you.
thank you for joining me on this journey.
Appreciate it.
Because I'm a novice here.
Me too.
So
First time
Again?
doing a podcast in my life.
Barbershop Therapy. We cut through the problems.
Can we cut through the noise? Talk about the pain till our problems all fade away. You either build or destroy. We gotta make a change, so we might as well start today. Barbershop therapy. Barbershop therapy. Where I know that they hear from me. Barbershop therapy.